So let's say we treat a suspensory body. We're gonna start our laser. I'm usually gonna use, if it's quite acute, use a setting number 5, and start, depending on the size of the lesion, obviously, and the depth of the lesion. That's gonna a little bit, decide what your treatment time is gonna be. So if you have a very focal lesion, and you can reduce the depth of it, then your treatment time will be shorter. If you have a larger area to treat, and the lesion is quite deep, your treatment time will be longer. So you have to adjust for that a little bit, and it's also very important in a way that you know where the lesion is, and obviously ultrasound, is the best tool to tell you where exactly the lesion is. So usually what I try to do is, I flex the leg, and I'll usually, if it's a good horse, have a little chair or something and let the leg rest on my thigh, and then I'll start program number 5 minutes to start. And then what I do is I push away my superficial and deep digital flexor, because they're now in a relaxed state, so I can get very close to this, or almost directly onto the suspensory body, and so that's my technique. And the same thing if I want to move up and treat more proximally, I flex it here, lower it a little bit, and really push in there, so I get as close to that suspensory area as possible, and kind of push away my superficial and deep digital flexor. So that's gonna change my treatment depth from, if you ultrasounded in a standing limb, which would be about 3.5 centimeters, to a flexed limb about 2 to 2.5 centimeters. So you get much closer to that tissue, and you're gonna have a better success rate when you treat, and shorten your treatment time. And I keep good pressure on it, again, to disperse the fluid and the blood, to minimize absorption of my energy while it's going through the tissues. So I'll treat the area locally, but then what I also try to do is think globally. So I also gonna always do photochemotherapy on the main artery that's supplying, that give the blood supply to where your lesion is, And in the front limb, if we're looking distal, that's your median artery, which sits on the inside of your limb, and your chestnut is a good landmark. You just go above the chestnut, and in front or behind your radius, and basically where the cephalic vein lays, but deeper, you'll have your median artery. And that's where I would then do photochemotherapy program 1 for 5 minutes to, again, cause vasodilation, increase the blood supply to the area, also bring in more oxygen, and help to remove wastage. So that's another thing I like to do. Don't just focus on the lesion itself. You have to think, okay, what is going to help to heal this area, and it's not just the focal effects, but also the global effects. So bringing in blood supply is very important. So that's where I think photochemotherapy is important to do that. And actually probably start with that to kind of open the blood supply, and then go and treat locally. The other thing I look at is, whenever we have an injury, the horse is gonna compensate, gonna get some guarding. So a lot of times when we have an issue, let's say in your suspensory or a distal limb issue, the horse is gonna get trigger points throughout the shoulder, just from guarding and protecting, and we want to release those trigger points. And so the same principle for the trigger points is like we just showed you with the laser acupuncture or the trigger point release. You find the trigger point by palpation, and then you do your trigger point release with program 6, 2 minutes, or you can use program 3 with a little bit longer duration, and release this myofascial tension. And then the fourth thing I do is like to say, okay, you know, the body is orchestrated by your nervous system. So I try to work on your nervous system that innervates that whole area. And so obviously it's in the front limb, it will be our brachial plexus, which will be here. Your access to it will be your caudal cervical neck area. So I would again work on those nerve innervations with the program 6, and then scan through this area for about 5 minutes. So we can show you that quick. Program 6. So I would palpate for the vertebral bodies, and we have the facet joints here, and then below the facet joints the nerves will exit the spinal cord, and we can do that in a sweeping motion here to kind of stimulate that. And it's just working on the nervous system. It's just the same as almost when we do our, unwinding program. We basically go over the bladder channel, but especially when we go in this back area, a lot of what we do is affect our nerves. And when we do the unwinding program, it's more the dorsal spinal nerves that we're affecting. I think that's very important as well, because if we think about the nervous system, there's not just our peripheral nervous system that helps with innervating muscles in the limbs and the rest of the body, but there's also the autonomic nervous system, and that's our two main parts, and that is our sympathetics and parasympathetics. And if you think again about healing, is sympathetics, they control your blood supply. If your sympathetic system is in overdrive, you're going to have vasoconstriction, you're going to have reduced blood supply. So it's important to kind of rebalance that autonomic nervous system, especially in horses that have pain or stress. That's where sympathetics will take over, and to kind of modulate that nervous system, we can focus on areas where we can access those things. And a lot of times what I'll try to stimulate the parasympathetics at the head or the pelvis, and the sympathetics are more stimulated through the thoracic area, or then where there's a lot of venous, arteriovenous anastomosis, like the cornet band, the tip of the nose. That's where we have a tremendous sympathetic output. So those are other areas then that you can use to laser to rebalance that autonomic nervous system and improve blood supply and healing to the tissue. Just looking at it from a whole body perspective, not just focusing on just local treatment of the lesion itself.